Our patient is Mr. Lyle in for a scheduled appointment. He's a 36-year-old Caucasian male who's had a 7-day history of headache post head-to-head collision during a soccer game. He did not seek immediate treatment for this incident. However, after several days of ongoing headache, he scheduled this appointment. He denies any post-history of concussion or head trauma and stated that before the incident, he was feeling well, taking no medication, and had no chronic diagnosed health conditions. Mr. Lyle stated that the onset of the headache was about 2 hours after the collision and stated that it's been ongoing for 7 days. He stated that initially it was localized to the left lateral area where he made contact, about at the frontal parietal junction. He stated that now the headache just extends across his forehead. The duration has been for 7 days, beginning in the morning and worsening over the course of the day with aggravating factors. He characterizes the headache as dull, aching, a tension, more of an annoyance, as he says. And he states that aggravating factors are prolonged screen use, including computer, TV, and cell phone, bright lights, excessive noises, as well as exercise. These factors are alleviated by rest, sleep, taking it easy, and medication. He states that there's no radiation of the pain anywhere else into his head, neck, or other areas of the body. So far, the treatments that he's tried has been ibuprofen, 400 milligrams, 2 tabs, once to twice a day, and he does find relief with this. He notes that the severity is about a 2 out of 10 when it is dull and annoying, but can increase to 4 out of 10 if he has several aggravating factors throughout the day. It has impacted his activities of daily living as he does play several sports, which he's not been able to play. He also films a YouTube channel, and the bright lights have aggravated his headaches as well. He's taken 1 day off of work, and that includes today for this appointment. He's coping relatively well, resting, taking medication. He has not played sports for 7 days, and he states that he's feeling okay, but just looking at getting back to what is his normal. Generally, he stated that he was fatigued, but denied any loss of consciousness at the time of the incident. He did say, though, that he was feeling a little bit dazed for about 15 minutes right afterwards. He denied any loss of balance or dizziness, syncope, or pre-syncope, but stated that he had 2 days of mild trouble concentrating and just felt absent-minded. He stated that he also was going to bed a little bit earlier than his baseline for about 4 days, but the absent-mindedness and the fatigue with earlier bedtime has now subsided. He also stated that he had no trouble falling asleep and no trouble being roused. He states that he's not feeling anxious or depressed. He has had no changes to his personality or overall thoughts and perceptions, or any changes to his cognitive functioning. He stated that his head was very tender to the touch at the time of the incident for about 4 days afterwards, but the pain has been decreasing. He denies any neck pain, any vision changes. He did not get a nosebleed at the time of the incident or afterwards. He denies any discharge out of the ears, but does say that loud noises do aggravate his headaches. He denies any shortness of breath, cough, trouble breathing, dizziness, hypo or hyperventilation. He denies any palpitations, trouble laying flat, or trouble going from a seated to a standing position. He has no changes in bowel or bladder habits, as he reports, and stated that he has no other joint or muscle pain or any other neck pain. To date, this is Mr. Lyle's first time to the clinic for this incident. He's currently taking ibuprofen, 400 milligrams, 2 tabs, once to twice a day, denies any other medication. He has no known drug allergies and reports that his immunizations are up to date. He has no previous history of concussion or head trauma that required investigation or hospitalization, but he does get tension headaches once every few months, which are relieved by NSAID medication. He denied any adult surgeries or any chronic diagnosed healthcare conditions. His family history is positive for maternal migraines, as well as his sister gets migraines. Socially, he's a non-smoker, denied any alcohol or illicit drug use, including marijuana. He's married, has no children, and is a teacher. One thing is that he really likes sports. He plays baseball, volleyball, and soccer, and stated that he does have a sport usually every other day, so not playing sports for 7 days has impacted him quite a bit. Upon physical examination, Mr. Lyle is a man appearing his stated age, well-groomed and dressed appropriately for the occasion and season. He is oriented to person, place, and time, and did not appear as in distress. He was appropriate in conversation, the context of his words, as well as the rate and rhythm. He answered all questions posed to him without observed recall difficulty. His mood was euthymic, with normal facial expressions, appropriate reactions, as well as eye contact and attention. His vital signs were temperature 36.8 degrees, respiratory rate 16, blood pressure 122/84, heart rate 77, oxygen saturation 99% on room air. His neurological exam showed that he was awake, alert, and oriented ×3. His cranial nerves were tested and normal bilaterally. His motor system showed no involuntary movements, tics, or fasciculations. He had normal muscle tone, symmetry, and size. His muscle strength was 5 out of 5, bilaterally equal and symmetrical. And his deep tendon reflexes were normal at a 2+. His sensory system was tested and normal. Coordination, his gait was normal, he had good balance and tandem walk. His point-to-point, as well as rapid alternating movements, were normal in all extremities, bilaterally, as well as symmetrical. He had a negative Romberg test and negative pronator drift. He also was negative for meningeal signs, including Brudzinski sign, Kiernig, and straight leg raise. His head, eye, ear, nose, throat exam showed that his skull was normocephalic with a 2 by 2 centimeter area of tenderness upon palpation at the left lateral frontal parietal junction area. There was no abrasion noted, no depression, no induration, and no bulging noted. The rest of the skull was unremarkable. His eyes were normal in alignment, no lesions, no edema or masses noted. The Snellen chart was 20 out of 20 for his visual acuity. He had normal extraocular movements and no nystagmus was noted. Cover-uncover test was normal, and his pupils were equal, round, reactive to light, and accommodation. His sclera was pink, conjunctiva white, no corneal opacity noted. An ophthalmoscope exam was done, and red reflex was present. Disc was round with sharp margins, no papilledema noted. Retina was normal, no abnormal pigmentation, hemorrhages, or exudate noted in the eyes bilaterally. The ear exam was done as well, and the tympanic membrane was visualized. It was gray, intact, cone of light was present, and there was no bulging or fluid noted. The rest of the nose, throat, neck exam were unremarkable. In summary, Mr. Lyle is a 36-year-old male presenting with a 7-day history of headache post a head-to-head collision during a soccer game. He rates his pain as 2 out of 10, but increasing to 4 out of 10 with aggravating factors. These aggravating factors include prolonged screen time, excessive lights, excessive noise, and exercise, while relieving factors are rest, sleep, and medication. He has no past history of concussion or head trauma requiring investigation or hospitalization, but he does have a history of tension headaches, getting one every few months relieved by medication. On physical exam, there was an area 2 by 2 centimeters noted in the left lateral frontal parietal junction that was tender on palpation. The rest of his head, eye, ear, nose, throat exam was unremarkable. His neurological exam was unremarkable. He's currently taking over-the-counter medication, ibuprofen, 400 milligrams, 2 tabs, once to twice a day for headache relief. His symptoms, as well as his past medical history and his physical examination, lead me to add post-concussion headache to the list of potential differential diagnoses for Mr. Lyle.